My name is Gina Dioquilla, and I'm the Program Manager for the Center for Assault Treatment Services. The Center for Assault Treatment Services, also known as CATS, is a program through Dignity Health Northridge Hospital. What we do here is forensic interviews and examinations for victims of interpersonal violence. This is our forensic interview room, and one of the rooms that many of our victims may come into when they first get to CATS. Everything that happens in this room is audio-visually recorded, but also there's a team in a separate room that's watching live what's happening. So in that team, it could be law enforcement, DA, city attorney, and social work. So anyone who really needs to be involved in that case for legal reasons. Because court can happen 2 or 3 years down the road, or even longer, these audio recorded interviews help to depict what's happening today when that interview is going on. So for instance, if you have a child, like an 8 or 9-year-old child that's being interviewed, it's going to capture emotion. It's going to capture what they look like when that abuse occurred, compared to years later when they've aged and they're a different person at that time. In some situations, people need a forensic exam after their forensic interview. So when that happens, we bring them into this room. And this is a very special room because we do a lot in here. We do medical evaluations on the person's body. We collect DNA from their body. We photograph and package all that DNA to give over to law enforcement. It's very important for us to stay trauma-informed and to make this room very comforting and non-clinical as much as possible. So you can see behind me, we have koi fish on the wall. Those fish are important because it's comforting, not only for our adult victims, but also for our children that come through. We see people of all different ages, and sometimes our kids could be fearful to come in. They maybe think that they're going to get shots or they're going to, feel pain when they're in here. So it's very important for us to help them feel comfortable and secure while they're here. When somebody first comes into CATS, they're teamed up with an advocate from Strength United. And that advocate's going to help them through the whole process while they're here at CATS. They can go into the forensic interview, they can go into the examination if the patient chooses. They'll explain to them the process and give them extra resources, maybe like on restraining orders or protective orders. We also have LAPD detectives who work under this building. So they're actually stationed here and work Monday through Friday. And the detectives are also here for security reasons. So the detectives work with us very closely on all of our cases to ensure that we have the best possible outcome for the patients. So a question that I get asked a lot is why I chose this type of nursing. So for me, this type of nursing has just been a passion. I learned about it when I was working in the emergency room. And once I discovered forensic nursing, I thought it was the niche that could help me spread my passion for helping others and for making a bad situation better. Many of our nurses that work here not only have the job here, but they work full-time at hospitals. So this is their second job. This is a job that they choose to spend their time at. Everybody has a different reason for their why, but when it comes down to it, each of our nurses are so passionate about what they do and helping people through this process.